Hello, dear students and esteemed learners. Welcome here. This is the ninth lecture of our course on Sociology of Health. And today I've included two very important theoretical perspectives to understand health, illness, and medicine. And these are symbolic interactionist perspective and post-structural perspective on health, illness, and medicine. So before these perspectives, we talked about the biomedical perspective, the functional perspective, and the Marxist perspective. And we also tried to understand why and how those perspectives played very important role in developing our understanding on health as such and sociology of health in particular. Now, these two perspectives, that is symbolic interactionist perspective and post-structural perspective, are not directly connected with each other. So don't confuse that these are interconnected. That is why I am talking about these two perspectives today. No, these are not directly connected, but because I needed to talk about both the perspectives, and so I have included in this lecture, and we will not talk about these perspectives at length, but we will just try to understand the core arguments and some of the important contributors within each of these. So, I have included a brief introduction of symbolic interactionism and then how symbolic interactionist perspective views health, illness, and medicine. And just like that, very briefly talked about post-structural perspective. And then out of the many post-structural theorists, I've included only Michel Foucault's work on illness and medicine because it will not be within the scope of this lecture to talk about all post-structuralist thinkers. So let's start. First, we will try to understand symbolic interactionism. Well, it is a micro-level theory that focuses on meanings attached to human interaction, both verbal and non-verbal, and to symbols. So, symbolic interactionism developed in sociology in the 19th century as a response to, or you can say as a reaction to, the macro-level theories. Because the structural functional theorists, which we have identified as the functionalists, they talked about the macro structure. They tried to see the society in terms of the system, subsystem, and larger structures. So, a reaction to that emerged in the form of symbolic interactionism, which communicated that people generally give a meaning or understand meaning or take meaning in their day-to-day life through their interactions. And so it is also important to understand those interactions at the micro level. And this is what is stated here. Now, whether those interactions are verbal or non-verbal, but if people share common understanding, then that communication is actually taking place. Symbolic interactionist theory has developed in the light of the theorists such as Cooley, Parks, Mead, Blummer, and Goffman. And there are many other people also, but I have not mentioned those names deliberately so that we can keep the things simple. According to this perspective, objects, humans, conditions, and events don't feature an intrinsic meaning. So whenever we identify a meaning, an event, or we see an object, or for that matter, we see an event, then some meaning is coming to our mind. But what is stated here is this, that those events or objects are not carrying an intrinsic meaning, but this meaning is given by people. So people in their day-to-day life, through their interactions within the group or among the groups, give some sort of meaning, and basically that meaning is over a period of time becoming part of the culture, and this is why culture is often considered as giving the context to understand that particular phenomenon. And that is why we have different cultures globally, and in every culture, although there can be certain common things, but we may identify those common things by different names or we may have some common type of practices or rituals, but we may give different names. So those names are basically given by those specific people who are interacting among themselves, and because they carry a specific meaning, and that is why this is understood as symbolic interactionism, because there is a symbol and there is a kind of interaction. Symbolic interaction is a process including the interpretation of actions, because symbolic meanings might be formed differently for anyone. Again, it is stated that it is a process, the process which includes the interpretation of actions, because when two persons are interacting with each other, then they may interpret the meaning in a different way in one particular culture, and when these two persons are interacting the same way in a different culture, then they may interpret the meaning in a different way. So this is how basically actions take place, this is how interactions take place, and this is how meaning is basically given to those interactions. This is the larger concern of symbolic interactionism. Now we will talk about the take of the symbolic interactionist on issues related to health, illness, and medicine. The focus of the symbolic interactionist is on how illness and the subjective experience of being sick are constructed through the doctor-patient exchange and not merely through the act or fact of physiological malfunction. So, biomedical approach talked about the causation of disease, biological determinism, or physiological malfunctioning. But symbolic interactionists say that no matter what that malfunctioning is at the physiological level or the biological level, but the understanding of that particular problem is actually emerging on the basis of the exchanges between the doctor and the patient. That means the way that interaction is taking place. One common symptom or one common problem may be understood differently by two different sets of people depending upon what kind of interaction is taking place between the patient and the practitioner. It highlights how individuals interpret and give meaning to health-related symbols and rituals within their cultural context and create a health culture. There are different ethnic societies or communities, and in every community we have different types of practices, some of which are related to the health issues or illness issues or even the medicines. So every community or culture is giving a specific nomenclature to some of the specific phenomenon or some of the specific processes, and this is how they make a subculture of their own in the context of health and medicine. It provides us with the new insights on the construction of illness and how health and illness cannot be strictly determined by medical criteria only. That means determination of the disease or illness is not only governed by the medical or biomedical criteria. We talked about the concept of illness and sickness when we were discussing the basic concepts. So the idea of sickness primarily emerged from the contribution of Parsons when he talked about sick roll. But the idea of illness emerged from the contribution of the symbolic interactionist. So you can relate the definition of illness that we discussed in that lecture with the perspective that we are discussing today, and then this will bring more clarity to you. There are many important contributors, but we have included only two names here because talking about all will not be within the scope of this lecture because of the time constraints. And one is Strauss and another is Goffman. Now Strauss made his contributions to theory and method in a number of areas, including influential work on social process of death and dying. So Strauss talked about the process of dying and death and recorded evidences on that. And he reflected upon the differences which basically occur during these processes at different levels. And so basically he focused on the interactive part related to that. And then observation of the negotiated order of hospital routine featuring a minimum of hard and fast regulations and a maximum of innovation and improvisation in patient care, especially in emergency treatment. Just like that, within the hospital structure, there are different situations, and for every specific situation, there are specific protocol or specific activities which are followed, which may not be necessarily the same everywhere, although the outcome or the supposed outcome could be the same. So this is how healthcare discourses or healthcare practices actually build up. Although the word discourse could not be used here, but because we have used this word when we were discussing Foucauldian perspective, so that word came to my mind here also. But discourse is a word which has been used generally by Michel Foucault, that we will talk about later. Here the focus is on the interaction pattern. One of the key symbolic interactionist theorists who contributed to the field of medical sociology is Erving Goffman. Because of his interest in how individuals develop their identity through the way in which others view them, he undertook an in-depth observational study of patients' subjective experience in mental institutions. Now, there are so many things that we can talk about Goffman, but I have included only few arguments to understand his contribution. And basically, one important thing here is the subjective experience, because when we were defining illness, we had stated that it is a subjective experience. So Goffman is also focusing on the subjective experience, and he has given an example of asylums, right, where he is talking about the notion of total institution, and it is related to a mental conditioning of health or mental health like situation. And then he is talking about the different types of practices and the different behavior patterns or the different interaction patterns which take place under these institutions, and the focus will be on understanding and giving meaning to those interactions. So what is the main contribution of symbolic interactionist perspective? We have summarized the whole discussion in one single statement. Symbolic interactionists make us aware of the importance of communication between physicians and patients. Physician means doctors basically, or the medical professionals. So between the physicians and patients, including factors that may reduce effective medical treatment for some individual. So ultimately, the symbolic interactionist perspective is talking about the kind of interaction which is taking place. Now, that interaction may take place between a doctor and a patient, or maybe a patient and the paramedical staff, or maybe among the family members also regarding that particular problem, or maybe the person who is in need of healthcare and any other agency which is providing that kind of healthcare. And there can be different types of healthcare provider. In forthcoming lectures, we will talk about the different systems of medicine, and there we will see that there are many different systems of medicine and which operate on different principles, but people do have some kind of engagement with all those different systems of medicines and their various agencies. That means this interaction with those systems of medicine, that do give them some kind of relief from the problem that they are often suffering from. And we can also make use of this understanding to understand the behavior of some of the health providers which are not often considered as designated health provider, but people do get involved in that. And then there are certain concepts like medical narrative. Now, and on the basis of that, basically narrative medicine. So sometimes that narration in itself is having some kind of healing impact, right? So in different situations, people have different types of interaction, and those interaction basically give different levels of satisfaction to people, and they are understood by different context or meanings. So that is the core argument on the field of health, illness, and medicine. However, these approaches have been criticized for suggesting that few objective medical criteria exist for many illness. Now, this perspective is also criticized, and it is criticized by, again, the biomedical theorists, because they consider that they have underestimated the significance of biomedicine and the diversities existing within biomedicine, or the specializations existing within biomedicine and the modern healthcare system. Because the symbolic interactionists have overemphasized the micro level issues without giving adequate recognition to the macro level issues, such as the effect on healthcare of managed care, health maintenance organizations, and various hospital chains. Right? That means they have somehow underestimated the utility of the macro structures. And as we stated earlier, this perspective primarily looks at the things from a micro perspective or the interaction perspective. So this is the brief discussion on symbolic interactionism and its contribution to understand health, illness, and medicine. Now we switch over to the second part of the lecture, which is the second perspective, and which is post-structuralism. So we will briefly try to understand post-structuralism, and then we will try to understand the contribution of Michel Foucault, because he is considered one of the most important post-structuralist theorists. Post-structuralism is a late 20th century development in philosophy and literary theory, particularly associated with the work of Derrida and others. It originated as a reaction against structuralism, which first emerged in Saussur's work on linguistics. So, students of sociology would be familiar that within sociology and in general, within sociology in particular and social sciences in general, several theoretical perspectives emerged. Structuralism and post-structuralism is two of those various theoretical perspectives. Before structuralism, we can see the emergence of phenomenology and ethnomethodology also, and simultaneously with these two, we had the emergence of symbolic interactionism also, that we just talked about. So we will not talk about basically structuralism, because again, time will not allow us to take into consideration all those discussions. So post-structuralism is primarily a critique of structuralism. Post-structuralist critique of structuralism typically challenge the assumption that systems are self-sufficient structures. That means structuralism primarily assumes that systems are self-sufficient structure. And so the post-structuralists question the possibility of the precise definition on which systems of knowledge must be based. So structuralism has its own assumptions, but post-structuralists actually make a critique of that and often reject many of the arguments. And one of those core arguments that was held by the structuralists was that systems are self-sufficient structures. Post-structuralism refers to a way of thinking that emphasizes the radical uncertainty of knowledge, particularly knowledge in language, and posits that truth is not a fixed concept. Now, this is very important. If we want to identify post-structuralism by one or two statements, then we can identify it with these few statements. First, that it refers to a way of thinking that emphasizes the radical uncertainty of knowledge. Because within the structural school, there was an argument for a definite shape or a definite system of knowledge that is known as a specific structure and a specific kind of certainty. Now, post-structuralism questions that and talks about uncertainty of knowledge, and poses that truth is not fixed concept. If there is uncertainty of knowledge, then truth will not hold a specific meaning or a fixed meaning. And so they say that truth is not a fixed concept, but instead constantly changes based on our cultural, political, social, and economic position in the world. So, as we all know that in the society there are different types of cultures, there are different types of political, social, and economic setups. So, within those different cultural, political, or economic setups, the certainty of knowledge cannot be ensured because certain things, facts, or truths may not be seen the same way in all these contexts. Foucauldian theory. Now, within this post-structural school or perspective, one of the important contributor is Michel Foucault. So we will talk about some of the works of Foucault here. Foucault, in his works like The Birth of the Clinic or The History of Sexuality, explored the relationship between power, knowledge, and medical institutions. Foucault, in general, talked about the power component in the existing society. And he also talked about knowledge, and basically, knowledge is power. This is one statement which is associated with Michel Foucault, and this statement basically is very complex in itself, because for understanding this statement we need to understand Foucauldian perspective on knowledge and Foucauldian perspective on power. His analysis highlighted how societal power dynamics influence medical practices and the construction of health norms. Then again, for Foucault, power is not a fixed kind of concept or a fixed entity. Rather, it's a dynamic, it's evolving, it's contextual. And then he talks about the application of these concepts in the context of the medical practices and the construction of the health norms, right? So whenever we talk about certain health norms, then these are not given, rather these get constructed. So how do these get constructed? Foucault is trying to talk about those things in his own style. Michel Foucault was a French philosopher whose main works focus on historical analysis of social and institutional processes. Now, social and institutional processes again is a term which could be interpreted in multiple ways, but primarily we can assume or we can state that the various institutions which are existing in the contemporary societies, he is talking about the processes which are taking place within those institutions. His historical approach does not consist of an analysis of particular historical subject, but the aim is to shed light on the systems of thought that govern a particular period. So when he is talking about the things in a historical context, then he is talking about a specific context, and those contexts are identified as epistemes. And those are primarily dominated by a system of thought, and that system of thought is actually governing that particular period of time. So with this concept of episteme, he is he is trying to explain the specific historical developments in human history. These systems of thought in Foucauldian analysis are named epistemes. The episteme of a particular era or period shapes the knowledge, conceptual possibilities, and the discourse of that era or period, extending beyond the consciousness of any particular subject. This approach, often found in Foucault's work, came to be the archaeological method in philosophical analysis. Now, let me very briefly say that Foucault used two specific terms like archaeological method and then genealogy. And he tried to understand several things by making use of this archaeology and genealogy. And I have tried to summarize that in this paragraph. So, read this para carefully. This approach, often found in Foucault's work, came to be the archaeological method in philosophical analysis. In order to account for transitions between several archaeological periods, Foucault talked about genealogy. So, on the one side, he's talking about archaeological period, and then there are several archaeological periods, and so the connection between those archaeological periods is basically understood by making use of another phenomenon that is identified as genealogy. And Foucault mainly used genealogical method to show that transitions in history were contingent rather than rational and inevitable. Foucault was concerned with the archaeological and genealogical analysis of the medical discipline and socio-medical processes. So, very briefly, we have referred to the archaeological and genealogical analysis here, but our interest is application of these terms in the medical domain as Foucault has used it. Trying to clarify the episteme that characterize the generation of medical knowledge and discourse. So basically, in certain episteme, certain archaeological periods or archaeological method and genealogy produce a specific kind of medical knowledge or a specific kind of discourse. So now this is where we make use of the word discourse, and it denotes the generation of a specific kind of knowledge, and in this context a specific kind of medical knowledge. In the birth of the clinic, Foucault studies the development of medical knowledge and the clinic, in which the medical clinic and the hospital adopted clinical method and came to be teaching hospitals. The major contribution of Foucault to medical sociology is his analysis of social functions of the medical profession, then including the use of medical knowledge as means of social control and regulation, as he studied madness clinics and sexuality. Now, Foucault is not talking about these institutions or this phenomenon in a very simplistic way. Rather, his representation of these things are very abstract. So, he is saying, or he is talking about the social functions of medical profession, including the use of medical knowledge as a means of social control. That means medical profession is used for the social control and regulation of the patients in general, or in a specific situation. You can talk about the situations like madness, clinics, and sexuality. That means the idea of sexuality is often regulated by the medical profession, and that would be one of the functions of the medical profession. And this is how he is talking about some kind of system of surveillance operating in the modern societies, and that is operating somehow under the influence of maybe the state or the church or any other agency. The surveillance of human sexuality by the state, church, and medicine subjected the most intimate bodily activities to institutional discourses and monitoring. And when in the history of sexuality, he is talking about the surveillance of sexuality, then he is saying that this sexuality is one of the most intimate aspect of a person's life, but this is becoming a subject of medicine, and this is how it is not only monitored, but a kind of surveillance is also taking place. And this is how he is talking about the power of the institutions basically, and the power of the medical profession or medical institutions. Thus, bodies themselves came under the jurisdiction of experts on behalf of the society. Foucault found two distinct trends emerging in the history of medical practice. One is the medicine of the species, which is basically the classification, diagnosis, and treatment of disease, and then medicine of social species, which is related to prevention of disease, and the second is basically identified as public health in contemporary societies. So, we will talk about the contribution of Foucault when we will take up the topic on medicalization, because Foucauldian writing is often a critique of the medicalization process. So, we try to understand the contribution of Foucault here in the context of illness and medicine, so that we can have some kind of familiarity with the theoretical perspective, and there are other people also among the post-structuralists who have contributed in the field of health, illness, and medicine, but we cannot talk about all of them. So I hope you got an idea about these two perspectives, the symbolic interactionist perspective and post-structural perspective, and especially with the contribution made by Foucault to understand the positioning of illness, health, and medicine in contemporary society. So thank you very much. Before we close, we have the last slide. Think about this. Do people identify a specific disease and ailment by different names and symptoms? On the basis of your own empirical observation, think about this. And then a small activity question. Do you think that medical professionals exercise a specific power over the patients? Again, use your empirical understanding and try to write something on this. So, I have not used multiple references in this presentation, kept the things very simple and referred to the contributions, the original contribution of the author, which I have already mentioned in the presentation. So with this, I conclude this session. We will meet in the next lecture. Till then, take care.